Hi, I'm Dr. Thais Aliabadi. For over 25 years, as an OBGYN, I've helped countless women navigate the challenges of PCOS. I created OV to bring you a scientifically backed solution that supports the symptoms of PCOS with powerful ingredients. OV supports hormone balance, body composition, metabolic support, and beauty from within, giving you a comprehensive approach to supporting your health. It's more than just a supplement, it's a product born from decades of experience and a deep commitment to women's health. Visit OV.com to learn more and start your journey to better health today. That's OVII.com.
So today on SHEMD, we have Dr. Shelby Harris, who's the author of The Women's Guide to Overcoming Insomnia, Get a Good Night's Sleep Without Relying on Medication. She's been in the New York Times, The Today Show, Good Morning America. I personally have been stalking her, so I can't tell you how excited I am to have you on the podcast today. If you're following me on Instagram, you know that I am on a quest to fix my sleep, as so many women that are perimenopausal and menopausal are. And I learned so much in my research, even for this podcast. So thank you for being here. And I want to hear everything. So how did you get started in this space? And how did this become
Yeah.
your life mission?
Well, first of all, thanks for having me. I'm really excited to be here and talk all about sleep. So, I initially became interested in sleep because I was actually a sleepwalker as a kid. So, yeah, I had to have the bottom bunk at sleepaway camp and all these things. And I was just kind of fascinated with how did I do this, like without realizing that I was doing all these complex things. And then when I went to college, and then the year after I graduated, I decided to take a year off where I worked in research, and I was debating becoming a professional musician or a researcher in psychology. And they put me on a study that looked at people who were in early rehab, like we're talking first 30 days for alcohol dependence. And they were actually looking at using trazodone to help people sleep better. And they found that when people slept better early on in their rehab, they actually didn't go back to alcohol. Their relapse rates were lower. So that just set off this light bulb for me that said, why this was 2000. Why are we not talking about sleep and recovery and just for the general population? And that's what got me started thinking about how we could use sleep in psychology and then going that path.
You specialize in behavioral sleep medicine, which is BSM. Can you tell us what that is?
So behavioral sleep medicine it's like a subspecialty in sleep medicine. Many of us are psychologists. You don't have to be, but many of us are, or therapists, and we work with in evidence-based management strategies for all sleep disorders, not just insomnia. So I work with patients who have apnea, narcolepsy, idiopathic hypersomnia, restless legs. So I can do non-medication approaches to all different sleep disorders besides just insomnia.
What is restless leg syndrome?
So restless leg syndrome, really common in women, especially during pregnancy and perimenopause. I have it myself. It's when the night gets closer, your legs, and it can actually be your arms or your trunk, not just your legs, just feel restless, like you have to keep moving them. Everyone describes it a little different. And it just gets worse as the night gets closer. And it actually can impact the ability to fall asleep. So it looks like insomnia, but it's just like restlessness. And it sometimes gets misdiagnosed as anxiety in a lot of people. So if you notice that your legs and your arms are just like restless, bring that up to your doctor.
And how do you treat that?
So one of the first things we might do is just basic sleep hygiene stuff. Sometimes it's too much caffeine or alcohol, but if that's not it, then we might actually test your iron levels because sometimes it's an iron deficiency. And if that's not an issue or they've treated it and it's still an issue, then there's different medications they can use.
Do different people need different amounts of sleep, or is that true? Like some people only need 2 hours and some people need 12 hours, or is there sort of an average that every person should try to hit?
Yeah. So the number 8 that most people reference or have heard is really just because it's in the middle of 7 to 9, and 7 to 9 is kind of where most people fall in that range. Now, 7 to 9 hours is really about what amount of sleep do you get where you feel well rested and refreshed to go about most of your day. There are some people who are outliers who need less than 7. and some people who need a little bit more than 9. 2, I would argue, if someone's getting 2 hours of sleep a night, that's very unusual. It's getting in the way of you living your life, then I would talk with the doctor for sure.
What are the signs that you are getting too much sleep or not enough sleep? And how do you figure out that exact, amount that you need?
I mean, there are some people who are night owls, who are early birds, and it's whatever schedule that works in your life that you can do. So if you find that you sleep, let's just say, naturally have to get up at 7 a.m., let's just use that as an example, and you have to do that most days of the week to go to work, and that's okay for you, but you're not sure if you're getting enough sleep at night, what I usually recommend to people is to just maybe set a bedtime of 12 a.m. to 7 a.m. Do that for a night, and if that's okay and you sleep fine during that period, maybe move it to 11:45 for a night or two. Then 11:30. When you start noticing that you're going too big of a window is when you start having trouble falling asleep or you're waking up more in the middle of the night, then you almost got too much. And that idea of too much sleep is often like you wake up and you might feel even more of like hungover, like you woke up and you're in like too deep of a sleep state, or you just don't feel like your sleep's restorative, because there are a lot of people who have like sleep apnea, for example, or snoring issues at night, and they don't have very restorative sleep. So they might be sleeping longer hours. The other thing I would say is if you're not sure kind of where to even start, if you're lucky enough to go on vacation and not have to get up like with your kids or anything in the morning, just go to bed naturally when you feel sleepy and wake up without an alarm, and do that for 7 days. Track it on a diary and then kind of average together the amounts that you were getting days 4, 5, 6, 7. And that's probably your sleep need and kind of your natural body clock as well.
So I used to think I needed a ton of sleep.
Yeah.
But I would sleep, 10 hours a night and I would wake up and just not feel rested. And
Yeah.
so that I'd think to myself, okay, I need to add more sleep. Let me, add a nap in the middle of the day. So I'm recently sort of trying to do what you're saying, which is, hey, I might
Yeah.
be getting too much sleep and that might be
Yeah.
the problem. So what do you think about naps?
So naps are great for many people, but not everyone. So naps are, if you can't get through the day without napping, then okay, that might not be great. If you need multiple naps, that's probably not great. But a nap in and of itself for 20 minutes before, most people say 2 p.m., but that's really just because it's 8 hours before when you would go to bed. So about 8 hours before. A nap for 20 minutes is fine if you want to do that. Do longer than that, and that can actually impact your nighttime sleep. Or you might wake up actually that feeling of actually being groggier from a nap when you do that.
Right.
One other thing though is that naps are not great if you have insomnia. So if you're struggling with sleep at night, taking a nap is almost like snacking on sleep, that you're stealing it from the nighttime. So in insomnia, patients with insomnia, we're trying to not have them nap as often as possible to build up that appetite at night for sleep.
So again, I'm just going to use
Yeah.
myself as an example. I'm somebody that flips and flops and flips and flops. And sometimes, I wake up several times during the night and
Yeah.
sometimes have a hard time going back to sleep. That could be perimenopause and menopause, and we'll jump into
Yeah.
the sleep stages there. How do you know if you have insomnia or if it's just your typical, you know, pregnancy, perimenopause, the different stages of life that cause sleep disturbances?
Okay. So insomnia in general, the way we think about it now is it's not insomnia secondary to an issue. So if you're in perimenopause, if you have PCOS, if you're pregnant and you still have trouble sleeping, that can still be insomnia. It doesn't have to be because of a certain reason. You still will have insomnia. Now, what is insomnia? So insomnia is trouble falling asleep, staying asleep, or waking up earlier than you want it to be, and it has to cause an issue for you in your life. It's very subjective. So if you feel like it's a problem for you and you have trouble falling asleep, staying asleep, or waking up early, and it's happening at least 3 nights a week for at least a month, that's short term, and it's happening for at least 3 months, which is most people that I work with, then that's chronic insomnia. So 3 nights a week of poor sleep for at least a month, or 3 months to be chronic. That puts you at insomnia, the diagnosis.
So are there studies that women with PCOS have a harder time with sleep?
Yeah, there is. We see higher rates of insomnia and sleep apnea in women with PCOS, and a little bit of restless leg, which is another thing we see in all the, like in perimenopause as well. But we do see much more apnea and insomnia. The apnea is not really necessarily due to weight gain in PCOS. We don't fully know why necessarily, but we do see those two sleep disorders often.
Do you treat someone with PCOS in a different way?
Not necessarily. I'll do some of the similar treatments, and then we might want to do some hormonal management with your gynecologist or endocrinologist for sure. I talk about PCOS all the time because I have it. So
You do?
yeah, I was a rare one that was diagnosed when I was 12. But then I know it was like 19, like late 80s, like that was uncommon. And then when I moved to New York, finding doctors who would believe that I had it was the challenge. So
It's
it's like, I know
incredible.
I have this issue.
I think 75% of women do not know they have it. And it's
Yeah.
one of the leading causes of infertility. You obviously know this if you have it, but what a blessing that you were actually diagnosed when you
I
were.
was very lucky. I had a real fierce mom who was like, this is not normal what's happening to my daughter. And I was very lucky.
So when I was doing the research, insomnia is more common in women. Women experience insomnia about 40% more than men. This was shocking to me. Between 10 and 30% of adults report having insomnia at any given time. So
Yes.
let's say you have insomnia. You have a client that comes to you. What do you do with someone that hasn't?
So what I do is something called cognitive behavior therapy for insomnia. So that's really the gold standard first line treatment for many people. And that really is about the same treatment for men, women, doesn't matter. If I am thinking about any sort of a hormonal component that needs to be addressed, then I'm going to refer to a gynecologist or endocrinology, someone who can really address that for women. But really, the treatment in of itself is about the same. CBT for insomnia, cognitive behavior therapy for insomnia, it's really a short-term treatment. I generally see people anywhere from 2 to 8 sessions, and it's really without medication, but it goes beyond sleep hygiene. Most people who have insomnia, they're like, I do all the things right. I don't watch screens before bed. I don't drink much alcohol. I do those things. That's really not a treatment in of itself for insomnia. Those are just good sleep habits. So most people who are trying all that sleep hygiene stuff, it's like you're brushing your teeth. One of my colleagues, Rachel Mamber, used to say, it's like if you brush your teeth and floss every day, which you should do for good oral health, that's going to help hopefully prevent a cavity. But there are plenty of people who still get a cavity even brushing and flossing. But then once you get a cavity, you can't just brush a cavity away. You need to start doing some other stuff. And that's how you have to think about sleep hygiene, because a lot of women and men too are just given this list of, well, limit the screens and avoid the alcohol at night, and then that should fix it. And it really doesn't in most cases. So what CBTI is it makes sure you're not drinking a 2-liter bottle of Coke, Diet Coke or whatever before bed, but then we limit time in bed for a lot of people. So if someone's only sleeping 6 hours a night, but they're in bed for 8 hours, I might actually limit the time they're in bed. I might work on what they're doing in the middle of the night if they wake up. So maybe it's getting out of bed if they're anxious or trying to force sleep to happen, and getting up and doing something in the middle of the night to just pass the time instead of lying in bed trying to force sleep to happen, because that ain't going to help. Effort is the enemy of sleep. So I'll have them get up and do something else just to pass time. Sometimes it's challenging the thoughts that you have about sleep. So if I don't sleep, XYZ will happen tomorrow. All these bad things are going to happen. I'm going to be a bad parent. I'm not going to be able to do well in my job. So it's helping people to temper their beliefs about sleep, that sleep is important, but it's not everything at all times. There are many reasons why we might be tired or why we might not present it well as work. And oftentimes we think of it as much bigger of an issue in our head than sometimes what it is actually in front of us. So it's about rationally thinking about your sleep to help temper those thoughts about it. Sometimes we add in mindfulness components, or we might do relaxation. So it's a multi-component treatment, but like I said, it works very well for a lot of people without necessarily relying on medication.
I want to walk through this protocol with you, which I
Sure
love
thing.
what you just said. You know, you brush and you floss your teeth, but if you get a cavity, you need to fix it. So there's one thing to have sleep hygiene, but it's another thing if you've got a real
Yeah.
issue with sleep. You recommend the 3-hour rule before bed for things like alcohol, exercise, and liquid intake.
Yeah.
So I drink so much water, and I have to drink water. I'm so thirsty before I go to bed.
Yeah.
And I have to take vitamins. You know, I'm taking,
Yeah.
which we'll talk about supplements in a minute. But a woman comes to you. She's
Yeah.
me. She says, "Okay, I I'm doing all the right things before I go to bed. I'm like you said, I'm using my bed for sex and sleep, and that's
Yep.
it. What do? I wake up 5 times during the night. I can't go back to sleep. What would you tell that person?
So with that 3-hour rule you were talking about, that's sleep hygiene, right? So they'll limit the liquids and the alcohol, like all that sort of stuff. If they aren't limiting liquids and they're waking up to urinate a lot at night, that might be something that we are going to target right off the bat.
Okay.
But if they're not necessarily waking up so much to use the bathroom, or maybe they're a little bit, I might actually limit the time. This is called time in bed restriction. It's a terrible name, but essentially it's limiting the time in bed for someone so that eventually in the next week, 2 weeks, they start falling asleep faster or consolidating their sleep more. So if someone's used to spending, let's say, 12 to 7 in bed every night, but they're only sleeping 6.5 hours or 6 hours, I might make them go to bed a half hour later to help them consolidate their sleep a little bit more. So getting up at the same time, but going to bed later. And that might actually help with limiting the amount of time they're awake in the middle of the night. And then the other things I want to find out are, why are you waking up so much in the middle of the night? Are there other reasons? Are you waking up with a busy brain? Are you doing things before bed that are more activating for your brain? Are you allowing some time to decompress your brain at night? And then other things that get missed a lot are things like especially during perimenopause, or snoring and sleep apnea. The rates go up dramatically in women, especially in this phase of life, and get missed all the time because you don't have to be the classic sleep apnea patient. You don't have to be overweight or an older male, right? I see a lot of women who are thin, fit in my practice. It's just your muscle tone changes as you get older. And with that comes more snoring and it's not overt loud snoring. A lot of times it's very faint, or it's pauses in your breathing. And that in and of itself can cause awakenings at night. So you can have apnea and insomnia together a lot. So you might wake up because you're not breathing as well and you're snoring, and then have trouble going to sleep because of insomnia. But you do have to catch the apnea, because a lot of people will say, "Hey, you're young, you're thin, you don't need." It gets missed all the time.
So what do you do about the snoring and the apnea?
A lot of times we'll start with just going and getting a sleep evaluation from an MD sleep specialist. You might be able to start with just a home sleep study, which is sometimes it's just a watch and a pulse ox, or it can be a chest band and a little oxygen sensor, or a nasal cannula. And so we might start with that. And if it shows you have apnea, then there's different treatments depending on the severity. So it might be the position you're sleeping in. It might be a CPAP for some people. It might be strengthening your airway with muscle exercises. There's a lot of things that we can do for sleep apnea. It doesn't always mean you have to sleep with a mask on, though, at night.
Well, that's good. Does it matter what position you sleep? Is there a better position? Back, side, stomach?
Not really. It really, however you're most comfortable. However, if you do snore a lot on your back, or you have, like, let's say, sleep apnea only on your back, we might recommend you sleep in a different position. But sleep however you're comfortable. People stress so much about it. It's like I was pregnant and couldn't sleep. I mean, I'm a stomach sleeper. I couldn't do that. The minute I had the baby, went back to my stomach because that's how I was most comfy.
I used to sleep like a dead person, just back up like that. And then I had
Yes.
babies and I had to sleep on my side with a pillow. And now that's the
Yeah.
only way I can sleep. I
Oh,
have to have
that's
this
amazing.
ginormous pillow right down the middle of me. Okay, so let's start off the night. So you say
Yeah.
you can't force sleep. That's one thing. So you've decided 10:30 is your time. Can you get into bed? Because I read at night. My husband and I
Yeah.
read at night. Is that something that you can do? I know no TV. You're not supposed to. This is the hygiene. You're not really supposed to watch television in your bed right before you go to sleep. That's correct, right?
Yes, I think the people are very fearful of the blue light sort of stuff. The blue
Mhm.
light is actually debated a bit in the field. But it's really, are you watching things that are very stimulating? Are you lying in bed? Because people will also delay going to sleep because they get sucked into stuff. I actually don't mind people reading for a little while in bed. I think people sometimes get a little too rigid with only sleep and sex in the bed.
Okay.
Reading is okay.
Okay, good. So let's just say you wind down, whatever it is
Yeah.
you do. I take a hot bath because I was told that warming your body up and then getting in the bed was a good thing
What time do you take the hot bath?
right before I go into bed.
If it works for you, fine. But generally, about an hour and a half before bed is actually, everyone says take a hot bath before bed. It really is about an hour and a half, 2 hours before bed.
What? Okay, that's one
It
thing I'm
gets,
going to
yeah.
change.
Yeah, the
Okay.
reason being is that before you're when the about 2 hours before you go to bed, your melatonin starts to rise as your body temperature starts to drop. So temperature drop makes melatonin come out, and that's about 2 hours before bed. So if you're taking a hot bath right before bed, you're raising your body temperature too close to wanting to go to sleep, that you're making it harder for your body to actually wind into sleep.
Okay.
So 2 hours before is actually ideal.
Amazing. Okay, great.
Yeah.
I did not know that.
Yeah.
Okay, so then I've taken my bath 2 hours before. Somebody can do, just the wind down routine, whatever it is that you're winding your brain down.
Whatever works for you that's relaxing.
So then get into bed and
Mhm.
I've been told, I want to know if this is a fallacy. Don't go to bed until you actually feel sleepy. Like, don't
Yeah.
get in bed and just because it's 10:30 if you
Yep.
don't feel sleepy. Is that correct?
Yeah. Yeah. Yep,
Okay.
that's totally. I mean, if you're some people don't get this like overt sleepiness feeling, but also look for like little cues. Like, do you find that you can't concentrate as well? Do you find that you yawn maybe a little bit? You have this heaviness feeling. It might not just be like your head bobbing, but yeah, look for little signs of sleepiness to go to sleep.
Let's just say you wake up and all of a sudden your mind is racing and you can't go back to sleep. Do you recommend somebody get out of bed? I mean, to me, that's stimulating myself again. But
Yeah,
I have been in bed for an hour and a half thinking and then finally gone back to sleep. So, and that's so stressful.
I know. You might, some people might hear that it's 20 minutes. If you're awake for 20 minutes, then go back, get out of bed. I don't like that rule because it makes you look at a clock and then like do this countdown. The rule of thumb for me is always you start to get frustrated or you start to like really try to force sleep to happen. Like you're like lying really still and you're like, why am I not sleepy? Or your brain is just racing about whatever, that's the sign you should get up and out of bed. And just the reason for that, and I get that it can be very alerting for some people, but it's the more that you're laying in bed trying to force your brain to quiet down, you're actually making it harder for it to do that. And just by getting, and you're pairing the bed now with wakefulness when it should be just about sleep. So instead, getting out and doing something just to pass the time, not necessarily finding an activity that's sedating. So a lot of people say, well, I get out of bed and I was reading and it didn't work for me. That's not the point. It's just finding something to pass the time that's quiet, calm, relaxing, that you don't resent. It's allowing it's like a placeholder until sleepiness finally comes. And then you
Okay.
get back in bed when you start to feel sleepy again.
Okay. I've never tried that. I literally lay in bed for 2 hours just thinking, oh
And
my God, go to
yeah.
sleep, go to sleep, go to sleep, go to sleep.
And it's that effort, right? And it's so common. It's people do it all the time. And I would say if you're like afraid you're going to lose the sleepiness, if you get out of bed, just give yourself like 5 more minutes. And if you didn't fall asleep in the next 5 minutes, you were fooling yourself. Then get out.
Then get out and then go back when you feel sleepy again. So when do you think you need medication or when do you provide medication for your patients and which ones do you think because I know I take trazodone when I need it when I travel and every now and again. I'm trying to not do that. I'm trying to find
Mhm.
natural ways to do the same thing that trazodone does. But what are your thoughts on medication and which ones do you like and which ones do you not like?
So I don't prescribe myself
Okay.
because I'm a psychologist,
Okay.
but I will have a conversation with patients and with maybe it depends. It could be their psychiatrist, their primary care, the gynecologist. It varies who's doing the prescribing, or sleep doctor, an MD. I'll have a conversation with the patient if they're really doing because they come to me for CBT for insomnia without using meds. If it's not working and they've been doing everything and we are now a few months in and it's really there's not been any gains, then what's the discussion of, okay, maybe we try a little medication or we combine a lower dose of what people would normally take with the medication with CBT, or we think about limits to using something as an on needed basis or as needed basis. Trazodone is a very popular medication. Every medication kind of some work better for some people
Right.
than others. It really does vary. The antidepressants, which is what trazodone is, they just use it in lower doses because it's sedating. Silenor, there's a bunch out there. Then you think about like the Ambiens, the Sonatas, Lunesta, that's a newer class of benzos that are used. So it really does vary based on the patient's age we think about, because we think about risk factors of falling and
Right.
cognitive issues. And it really just and then there's the newer ones, which are the orexin agonists. So those will help to really make someone it basically turns off your wakefulness promoting activity in your brain and help make you sleepy. Those are like Belsomra, Dayvigo. Those are the newer ones out there. There's not one that works best for everyone.
And so, in terms of a medication, when I look at my sleep and my
Yeah.
deep sleep versus REM versus light sleep, when I take trazodone, I get way more deep sleep and
Hmm.
REM sleep than when I'm not taking a medication, when I'm trying to do it naturally. In that instance, do you think it's better to take a medication because you're really getting that deep restorative sleep? Or do you think it's better to not be on medication and just have more light sleep?
I think it depends on, instead of what the tracker says, it's about how you feel.
Okay.
So if you're doing a treatment, let's say it's a behavioral treatment, and you're feeling better during the day, you might not get like the same kind of staging that you might with a medication, because certain medications also change up your sleep staging as well. But
Mhm.
it's really go by how you feel during the day.
Okay.
And if you feel like your sleep is lighter and it's bothersome to you and you've tried behavioral things and they're not working, then sometimes we would say, okay, there is a place for medication because the sleep you're getting at night does not feel restorative to you at all. So there is a place for medication, just not always as the first line.
And so, do you give supplements to your patients? And which ones do you like?
The supplement thing is so interesting. So I use mostly melatonin, but I use melatonin very differently than how it's usually used in like popular media, how people talk about it, and even on the shelves. So in sleep medicine, we use melatonin in very low doses. I'm talking a half a milligram to 1 milligram, which is hard for some people to find. But we use tiny doses, and we use it more for people who have trouble getting the sleep on the clock that they want. So they can sleep a full night. It's just not on the time clock that they'd like. So they might be a real night owl and just sleep later in the day, or a super early bird. We use it for jet lag, shift work issues. So we use tiny doses taken multiple hours before bed to help people actually improve their sleep. There's a lot of research behind that because melatonin is more of a time clock shifter for your body more so than an insomnia medication. So it's marketed for insomnia all the time. And the research on it's really not that great. So it just isn't as helpful. Some people swear by it, by all means. If it's helping you, fine. But you can find easily in the markets, you can find 10 milligrams of melatonin. There is no data for that whatsoever.
I mean, from the research I did on melatonin, it shows that the dosages are so high on what's on the shelves, and your body
Sometimes.
doesn't even make that much. I like what you said. I mean, I think it has been studied for jet lag, and I've tried it before with jet
Yeah.
lag just to
Yeah.
change the timing of when you sleep. But I can't find anything that says it helps with deep sleep and restorative sleep.
No, none of it really, it doesn't. And honestly, melatonin, I have patients come to my practice and they're like, I have really vivid nightmares and I just don't, or the vivid dreams or whatever it might be. I'll say, what are you taking? And they'll say, I'm taking melatonin. And the melatonin often causes vivid dreaming in people. So even though you can buy it on the shelves and it's over the counter, doesn't necessarily mean that it's without side effects. It can also make people even more sleepy during the day.
And what about magnesium?
So magnesium is not really a sleep aid in of itself. What it really does is I always say it like chills you out. It helps to relax people. So I don't use it myself with patients, but most patients honestly have tried it when they come to me. So if they find that it helps to relax them, that's always a good place to start setting the stage for sleep. So I have no problem with it, but magnesium too can cause stomach distress, GI problems. So you have to be careful with it too.
Nightmares and
Yeah.
vivid dreams. I have been somebody that always has crazy nightmares and very
Yeah.
vivid dreams to the effect that I can remember them the next day. I have a
Yeah.
recurring nightmare that I need to get hold of my husband and I can't remember his phone number. And I know I
Horrible.
have anxiety, so I mean,
Right.
so that is a part of my sleep issues is this my brain and
Yes.
my ADHD and it's just constantly moving. So I know
I
you
do too.
talk a little bit about vivid dreams and nightmares. Does it happen
Yeah.
more as you get older?
Not necessarily. It varies. It can be sometimes because of medication side effects. Sometimes people have had them their whole lives and never outgrown them. Sometimes trauma, anxiety can start. It really doesn't. It's not necessarily as you get older thing that you might have them, but we do have really good treatment for nightmares. A lot of people will go to like their therapist and they'll just sit and talk about their nightmares and like analyze them. And it doesn't really do that much. It might give them more insight into, well, I'm feeling more anxious, but it doesn't make the nightmares go away. So what we often do is something called imagery rehearsal therapy, which is literally, it's super easy treatment. That's fast. It's just changing the script or the narrative of the nightmare. So it could be like, if you can't get his phone number, maybe it's just his phone number shows up and then you call him and everything's fine. Like, and then you picture it and you literally picture that changed ending multiple times. Usually it's twice a day, every day. And then if you have a different nightmare, you change the script of that one, but you have to visualize it because nightmares are visual. So you have to picture it during the day. And the more that you do that, it actually can help people get some control over their nightmares. And then, like I was saying, we have medication treatments that can help for some people. Sometimes the medications you are taking can make them have nightmares. And then we also think about things like sleep apnea can cause nightmares in a lot of people too, for some reason.
So I have my nightmare. And so
Yeah.
during the day, I just visually think about me having his phone number, finding his phone number and calling him and actually reaching him.
You like take the same narrative and you change a piece of it so it's not scary anymore. So it might be, you can change it however you want. But for a simple example could be like literally just getting the phone number and calling him. It's not particularly exciting, but if you picture that new dream, because that nightmare probably feels very much like a broken record. Like, here we go again to a lot of people when they have
Yeah.
chronic nightmares. This is a way to break that pattern for some people. But yeah, it's called imagery rehearsal therapy. You look it up, you can find a lot of info on it for people.
Amazing. And I have I've also I have a child that had night terrors when he was
Yes.
little. What's the difference between nightmares and night terrors? And are they at different parts of the night?
So night terrors are different from nightmares. So those are often, not always, but often in the first third of the night. And those are like in deep sleep. And usually the person who has it, a night terror, we see them a lot in kids. But when they happen, they don't have recollection of anything or just a little bit of recollection of like an image. Nightmares, you have the image, you remember it very much. That's usually the last third of the night. So night terrors, we do treat. We sometimes want, if it's been going on for a long time, we do want to do sometimes a sleep study to make sure there's nothing going on in the middle of the night medically that's causing them. And then if not, then we work on it behaviorally from there.
Can we talk about just the stages of sleep? And we talked about you said 7 to 8 is an average of what
Yes.
everyone needs. As you age, do you need less sleep?
So that's a big misnomer. So you need a little less potentially, but as you get much older, we're talking like into your 50s, 60s, 70s, it's about a half hour less for some people, maybe an hour. What really happens more is that as people get to be older adults, they nap more during the day. So in a 24-hour period, it's actually the same amount of sleep that they used to get just at night. So you shouldn't, if you ever go to a doctor that's like, oh, you should be getting a lot less sleep as you get older, find a different doctor.
I love that. So babies, you're a baby. Do you believe in sleep training? How much does a baby need?
Well, babies, it can be any, I mean, it really varies how little, but we're talking like can be 16 hours or more based on how little the baby is. And then as they get older, they start to consolidate into naps a little bit less and spend more time awake. But sleep training, yeah, I think sleep training is great. It works really well for many people, not everyone. And I'm one of those people that's a fan of evidence-based treatments for kids and babies, but and anybody else actually. But it's really about what the family believes and wants to do as well that they can be on board with. So sometimes sleep training in the more traditional, like, yeah, we call it extinction, cry it out, all that is not for everyone. So I want to meet the family where they're at and try to work with them on something that's doable and manageable for their goals overall.
I just remember when I had my babies, you really think that your child is never going to sleep through the night. I mean,
Oh
that
yeah,
is in your brain. You are terrified that this baby is never going to sleep through the night. And I just want every young mom listening to this podcast, I promise you your children will sleep through the night. And there'll be a point when you can't wake them up when they're teenagers. They just sleep, sleep,
exactly.
sleep.
I have a 15-year-old and it's like, come on, get out of bed. Yeah, it switches dramatically.
Exactly. Okay, so let's talk about our amazing teenagers.
Yeah.
You talk about after puberty, sleep issues increase dramatically for women. Why is that? And what should parents and caregivers know about adolescent boys and girls?
When we see boys and girls as they're younger, before a woman has her period, the rates of sleep issues are about the same. It's just once the hormonal component adds in, then we
Mm.
see the rates go up a lot in women and young women especially. So I would just encourage, if you see your child struggling, your teen struggling with their sleep, don't ignore it. Talk to their pediatrician about it and get it evaluated, because it can impact their learning, their growth, all these different things that you don't want to ignore it.
And I know you also treat patients with anxiety and
Yeah.
depression and sleep, but with this generation, this anxious generation of
Ugh.
teenagers, um, how, as a parent, should we look at sleep with them? What lens do we look at when we're thinking of our teenagers and sleep?
There was a paper out about a year and change ago in the Journal of Sleep Health that was written by some very big circadian science researchers. And they actually suggested that timing of sleep, consistency of timing, is more important than amount of sleep that you're getting. So really being consistent. Now, what does consistent mean? Some people get a little too rigid with it. It's within like an hour and a half. So it doesn't have to be super exact. Now, with teens naturally start to they shift from being, obviously, from being kids, and when they're kids they go to bed earlier and they wake up earlier, and then when they become teens, or even like we're talking preteen, 11, 12, they start to naturally start going to bed later and waking up later, and that's actually natural biology for them. And what's the thing that makes them not get enough sleep right now? A lot of times it's school and the school start times. So you're in California, correct?
Yeah,
So 8:30, I think, if I'm correct, is like the minimum time by law there. It's supposed to be,
yeah.
but which is like the bare minimum that we recommend in sleep medicine. But many parts of the country, here in New York, it's not law. So there are a lot of kids who are getting up. I have patients that I've talked to, I have like relatives in Florida. Their kids are getting up at 6 in the morning to start school at 7. And so they're cutting off. These kids can't go to sleep earlier because they're not ready to physically, biologically. And then they're getting up too early to go to school. And what you're doing is you're cutting off those precious hours of REM sleep that happen the most early morning. And what is REM important for? It's important for emotion formation, emotion regulation. And so kids who are not getting enough sleep and they're getting up too early, they're cutting off their REM and they're really having more trouble with kind of just being able to, they're acting out more, a lot of them. And then we see risky behaviors happen a lot more.
Right.
We see issues with driving, with schoolwork, not and falling asleep in the mornings. It's really a problem.
So during the school week,
Yeah.
what if you were able to say what time do you think that they should go to bed and what time should they wake up on an
It really
average?
it on the average, I mean, if they're getting if they have a school start time, this is generous, and I know most school districts aren't like this. Let's say 8 a.m.
Hmm.
If they have to get up by 7:30, the ideal would be to try. I mean, the ideal, most teens should be getting 9.5 hours of sleep at night. I'm hard pressed to find a teen that does. So I would say like 11 would be great, 11:30 for a bedtime, ideally even earlier. But it's really, then you need to think about, are you overscheduling your kid? Are they taking too
Right.
many things on? Are the demands of schoolwork too much? Are they, I think about my teen, like all their schoolwork's on an iPad and their computer. So they're sitting there with all this tech in front of them until late at night. So it's really about having to also set those limits and trying to like get work done earlier so that they can
And
at least,
that, and I mean, we had a rule that you couldn't have your phone in your room
yeah,
to go to bed. But,
yeah,
now they're 18, 17. I can't,
yeah,
I'm
yeah,
trying,
it's
he's going to
harder.
college. I'm going to have, but
Exactly. But the younger teen, if you can get the screens and everything out of the room as much as possible, that will help as well. But I'd say like 11:30 would be that's still pushing it. But if you can do that, you're way ahead for many people. And then on the
um,
weekend, sleep in. On a Saturday, I'm okay with them sleeping in to catch up a bit. And then Sunday, maybe sleep in, but not as dramatically, like another 2 hours extra, but not until like 1 in the afternoon, because then they have trouble falling asleep Sunday night again.
but isn't that what bad then? Because it's such a difference in their sleep
It
hours.
is, but they're so sleep deprived
Right.
dramatically. I know what I was saying with the consistency is
Hmm.
important, but we also have to like, there's the reality of these kids just really getting way too little. So a little bit on Saturday, sleeping in more is okay, but then try to get back on track by Sunday. So
Okay,
you're
great.
getting,
Okay, great. That makes so much sense. Now, you just talked a moment ago about deep sleep being for
yeah.
emotional. So can you walk through us like light sleep is like what light sleep is for, what REM is for, and what deep sleep is for?
So when you're falling asleep, I'll take you through the different stages. When
Mhm.
you're falling asleep, you're awake, then you have this stage one. And that's just kind of this in between sleep. It's like you're the kind of twilight in falling asleep. Then there's stage two, which we'll get to. You kind of go through that. You stage three is deep sleep. So deep sleep is really when your body is, for kids and teens, that's when you're growing, right? That's when growth hormone comes out. That's when your body muscle repair. If you're someone who's exercising, if you're doing any strength training, that's when all that's happening, is repair for that during the day. So that's really your body repairing. And then you go from stage three, which is deep, to REM sleep. And a lot of people call REM sleep deep sleep. That's furthest from the truth. REM is very active. That's when we dream the most. You can dream in other stages, but you dream the most in REM. And that's when emotion formulation happens the most. So you're really having a lot of that. There can be some memory formation during there too. And then the other piece, then you wake up after that cycle and you do it all again. Now, as the night goes on, you spend more time at the beginning of the night, you spend more time in deep sleep. The last third of the night, the percentages change and you spend more time in REM. That's why we remember our dreams closer to the morning hours. Now, the piece that gets missed all the time is the stage two sleep that the trackers don't really ever talk about. Stage two is this middle level sleep that's actually about, for most people, about 65% of the night. So it's a good amount of the night. And what it is that's when memory can happen, memory formation. We see these specific signs on sleep studies called sleep spindles. So it's important also just for restoring energy. We see a lot of things happen in that stage two that aren't as exciting as deep sleep and REM sleep.
So, and there's really nothing you could do to get more deep sleep or more REM sleep. So if your aura ring says you have 2 minutes of deep sleep, there's nothing you can do. That's just your body. That's what it's.
Well, so the thing with the trackers is they're pretty good with telling the amount of sleep you're getting, but they're not as fantastic. And there's not some of them are more or better than others with the sleep staging. The real ideal way to do it is to actually put a sleep study on someone, like do an EEG part of it on their head. That's how we tell. So we can't really spot treat like certain sleep stages, but alcohol might affect REM more than other stages. But basic sleep hygiene is not going to do that. The other thing people don't take into account is that a lot of people take medications like SSRIs, and that actually can change up the staging of the sleep that you have already, which you might not necessarily know when you're looking at your ring. I am a big fan of just how do you feel during the day? How's your memory? How's your mood? How's your energy? All that sort of stuff.
Because on my quest for better sleep,
Yeah.
I have a Whoop on and I have an Aura ring on,
Yeah.
and they are both telling me the exact opposite
Yeah.
of, my Aura says I'm getting a little bit of deep sleep. My Whoop says I'm
Yeah.
getting a lot more than my Aura is saying. There was an NIH study that I'll link to the show notes that said that did the Apple Watch Aura. They really did a study to sort of
Yeah. Yeah.
say the different, and they're the best that it was comparable was about 75 to
Yep.
80%. So, um,
But the thing that I always argue with it is it's like I think the trackers are fantastic for people who are not making sleep a priority in their life. So if you're someone who is working too late, you're drinking a lot of alcohol, you're having caffeine, you're inconsistent with your sleep scheduling, it will help highlight that stuff for you. But if you're on a quest to improve your sleep, are these things actually helping you to make any other changes already at this point? And if it's just making you then overthink it, they're probably not doing as much as you would hope. And we actually, insomnia, we call it orthosomnia. So it's actually worsening sleep for some people because they're hyper focused on it, which worsens it.
orthosomnia. So that's like orthorexia. I learned
Exactly.
about that term too, where you're
Exactly.
just so focused on health that it's a form
It
of
backfires. Yep.
distorted eating. Um, okay. So, well, I probably have that. So that's all right. I'm going to work on
That's
that.
90% of people I work with who have trackers.
Okay.
I'm just like, is it adding anything for you? If it isn't, then maybe consider doing a week or two without it and see if that makes any difference.
And see if it helps. All right. So we've moved pregnancy. We
Mhm.
understand, like you're pregnant, you're gonna have sleep issues. Everybody just know that you're gonna get through it. It's just something that's happening. And then obviously when the babies are young, is there
Yeah.
anything that you tell pregnant women or women that have just had babies? Any tips that you have for them?
So there's a few things. So if you're pregnant and you're really struggling with your sleep or you're snoring a lot, I would definitely bring that up to your OBGYN or whoever the provider is for you, because that actually can impact the birth weight. It can gestational diabetes, early or preterm labor. We do see that sleep problems can actually worsen that. So bring it up. And we have medication, non-medication treatments available. When the baby is about to come, I encourage women to think about a best laid plans, right? Go out the window sometimes, but if you can think about some sort of a support network and plan for when the baby comes to help protect at least 4 hours, ideally 6 hours for you to be able to sleep. So are you going to solely breastfeed? Are you going to pump it all? Are you going to bottle feed? What are the things for you that might help to protect some sleep? And how would you do that in the rooming situation? That actually we find can really be very protective against postpartum depression and anxiety, especially if people have had anxiety and depression beforehand. So don't wait until the baby comes to start thinking about a plan. Do it beforehand.
Okay, Dr. Harris, you've talked about perimenopause and menopause as a perfect storm for sleep disruption. 40 to 63% of women report sleep disturbances during perimenopause and menopause, or even postmenopause. And the AASM found 50% of women aged 45 to 64 reported disrupted sleep. What makes it such a minefield? Is it the hormones? Is it just the great amazing things that happen to us as we head into this part of our life?
So there's three areas that I always see that kind of come together, and that's the storm. So the one that everyone talks about now is the hormonal changes, right? So you're having sharp drops in estrogen and progesterone, and these are all things that can definitely impact your sleep. And then we also see women are just doing more at this stage of life than they might not have in the past. So women are having children a lot of times later. So they're dealing when they're starting to hit perimenopause, they have kids still in the house. And then they also a lot of times are dealing with aging parents. So there's all these societal demands of this like sandwich generation that's happening with with women in general. And we also see women working outside the home a lot more too. So there isn't this like demarcation of day versus night. A lot of times it's like I'm doing all this stuff during the day and then I get home and I'm taking care of the kids and I'm also doing work and I'm doing all these things that you're just running around. So there's that. And then the third area is that women tend to have higher rates of anxiety and depression too. So you take both the psychological, biological, and the social, and you put them all together, and it's like that stage of life when it all happens. Fun.
Well, so as I'm dealing with this right now, I have sick parents, I
Yeah.
have teenagers, I have two companies, I have a flourishing marriage, I have friendships that I want to nurture. It is this time
Yeah.
in my life that is so magical. I mean, I love every single minute, but I am running with my head cut off and about to have a nervous breakdown half the time. This is 100% happening to me and so many women that I know.
Me too.
Okay, so you have a woman in her 40s. She's suffering from sleep. She has
Yeah.
insomnia at this point. Is it the same protocol that we talked about earlier, which is, okay, you have healthy sleep habits, then you get into bed? I mean, how do you counsel a woman in perimenopause and menopause? Like, what are some of
Yeah.
the tips that you give?
So, like we were talking earlier, CBT for insomnia, I don't mean to like harp on it, but the data behind it is really strong. It's really useful for a lot of women. They've done research looking at it in perimenopause and menopause and it being very useful. That can be useful for some people, and menopausal hormonal therapy can be really helpful. Sometimes it's medication. I've even seen like there's not a lot of data on it, but like sometimes acupuncture can be really helpful for some women. So there, like I said, it's not a one size fits all. We just try at first not to use as much medication as possible. It's a very similar thing. It would be looking at tracking your sleep on a diary, not necessarily with a tracker, but like actually writing down how you're sleeping. And then limiting time in bed, working on some of the worries. So a lot of women are very worried at night. So especially once they hit that perimenopausal stage, they can't turn their brain off. So we might do some worry time, some worry management strategies before bed, really focus on consolidating the sleep by spending that limited time in bed. And then also, what are you doing in the middle of the night? Are you getting up? Are you looking at your phone? And then also I do a lot of mindfulness meditation with patients because patients find that they just can't turn their brains off a lot of times. And so if you do some mindful meditation, 5 minutes during the day, it doesn't have to be anything fancy during the day, practicing it actually helps to quiet the brain more at night because you're better at recognizing when your brain's going a mile a minute, that you can then rein it in a little bit easier at night. So do it during the day, and it will hopefully, after about a month or so, start to benefit you at night.
And that could be anything. That could be transcendental meditation. That could be breath work. That can be anything.
It's the real goal of mindfulness meditation is really about, it doesn't matter what the exercise is. It's just about recognizing when your brain is wandering and bringing it back to the exercise. So when I first ever did mindfulness exercises, I was in graduate school and I used to have this long day and I had a little break and I would get my nails done. And I remember we were learning about meditation and I was like, oh, that's so ridiculous. I don't want to do it. So I realized one day, like they were giving me a hand massage for that 30 seconds and I never focused on it. And I finally just started to focus on the pressure and like the feeling of the massage. And when my mind went to, oh, I have all this stuff at school. This is the dumbest thing ever. How am I, back on the hand massage, back on the hand massage. You can make it even that simple. It doesn't have to be complicated. There are a million apps out there, but they just give you something to focus on so that when your mind wanders, you bring it back. And that's the goal. It's just the bringing it back to whatever.
What are your favorite apps for mindful meditation?
There's not one favorite one. I personally, and I've done work with them, so full disclosure, but I like Headspace a lot. Calm, they just have different vibes and different types of instructors. There's also meditation in studio that's on there. It's just about finding something that doesn't make you not want it, that makes you want to do it, shall I say. And find ones that have shorter meditations. So start with, even if 5 minutes is too much for you, start with 1 or 2 minute meditations. So I saw one that had like a meditation to do while you're standing on line at Whole Foods. Start there. Like
Boom. That's a good
easy.
one. I have to say, because of my ADD and my anxiety, and it's so hard as a woman, and I'd like to just touch on that for a minute. Sometimes in women, ADHD and anxiety you can think you have anxiety and you have ADHD, or you can think you have ADHD and then you have anxiety. And because this is such a big thing that happens to women all ages, it
Yeah,
starts
all ages.
young. You might have a young girl who you think has ADHD or you think has anxiety, and it's the opposite. Can
Yeah.
you talk a bit about that and how you treat women with either one of those or both?
I don't focus so much on ADHD in my practice. I mean, I have patients with it. People usually come to me more for the sleep stuff and anxiety,
Mhm.
but a lot of it is just about the busy brain. So for me, the fundamentals are always there. So I will still do mindfulness meditation with most of my patients and guided practice and just trying to get better at doing that because it takes time to work. But then I'll also do a lot of organizational management, right? So helping people, time management, right? So sometimes people, especially those with ADHD, they tend to get sucked into doing so much stuff that when it comes time to go to bed, that like it gets delayed more. And then not being able to make time for sleep can worsen the anxiety and the ADHD. So a lot of kind of organizational stuff and time management. And then I'll do a lot of anxiety management strategies with people, whether it be worry time, earlier in the day, worrying, like focused worry sessions, exposure exercises, so they can kind of get used to the feeling of the anxiety and not escape it as much. So when you get better at doing the thing that you're fearful of, it doesn't become as fear inducing for you. So I'll do all those different strategies with people.
This has been amazing. Before we leave, just walk us through the non-negotiables for better sleep.
So quiet, dark, cool, and comfortable. That's just a good starting place, right? And to allow for a little bit of time to wind down. The other non negotiable for me is if someone says to you that it's normal to have disrupted sleep as you get older, don't accept that. We can always intervene, find a sleep specialist who knows what they're doing and really can help you, because suffering in silence is not going to help. And then another non-negotiable for me is really allowing time for your brain to wind down before bed, because whatever's on your brain before you go to bed is going to be there in the middle of the night. And then also, if you just don't ignore snoring. So if you're doing any consistent snoring, pauses in your breathing, get that evaluated, because that could actually be a big piece of the picture.
Okay, and then what are your no's? Absolutely don't do this.
I'm like not big on like, don't do this ever, but try to limit alcohol within 3 hours of going to bed. Try to limit any caffeine within about 8 hours. Everyone metabolizes it a little different. So we usually say about 8 hours, and try to like not even though you might be cold at the beginning of the night, try to not have the temperature jacked up too high because it's going to come back and backfire you in the middle of the night. So, and I try to also encourage people to not fall asleep with their phone in their hand. So that's never a good practice to have. So really try to like get the phone out of your hand while you're going to bed.
And how cold do you want the room to be if you have a choice?
I would say anywhere in like the mid to upper 60s Fahrenheit. People might see 67 degrees reported online in places. That varies based on where you are in the country, because a 67 in a humid environment is different than 67 in a dry environment. So you just want to keep it somewhere in the 60s ideally.
And do boys and girls and men and women need different amounts of sleep?
Not really. So
Oh.
that's a whole thing that goes around online all the time now. Don't know why. Women generally need about 10 more minutes on average of sleep than men. It's just they sleep deeper than men. They typically get deeper sleep. But here's the problem. Women also have more insomnia than men. So even when they want to sleep more, they struggle with getting that sleep. But they don't need hours more when they're menstruating. That's all a myth.
I love debunking myths on this podcast. It's one of my favorite things to do. Okay, waking up. 3 tips. If you wake up in the middle of the night, 3 tips that you give somebody.
So the first thing is to try not to look at the clock in the middle of the night or your phone, which is usually people's alarm clock, which I say don't do. So don't look at the clock. Also try to stay away from your phone and any content on it, because that might wake you up too much, and try not to force sleep to happen. The more you're trying to force it, you're going to make it not happen.
But you still can't go to sleep. What do you do?
Get out of bed. I would say get out of bed, do something until you get sleepy again. Just do something like reading, or even there's this cognitive shuffling exercise everyone's talking about now. So it's just about going through the letters of the alphabet and finding like an animal for every letter, or just whatever word for every letter. And it's activating enough that you have to think, but it's boring enough that it will help you to relax a little bit more to maybe sleep.
Do you do that in your bed or do you do that outside of bed?
You can do that for a little while in your bed, but if you're going through all the alphabet multiple times, then get out of bed. It's not working.
Then get out of bed.
It ain't working.
So if somebody's listening right now and having sleep issues and doesn't even know where to start, what do you say to them?
I would say make sure your sleep hygiene, like we've talked about, is on point for about 2 weeks. If that's not enough, then go talk with your doctor to get a referral to a sleep doctor, and then go from there.
Amazing. Thank you. This has been so incredible. I'm going to go.
Good.
I'm going to take my bath 2 hours early. I'm going to get out of bed instead of laying there for 3 hours stressing about the fact that I can't go back to sleep and thinking about everything else I had.
Stress ain't going to help. Yeah.
That's not going to help. Thank you so much for being on SHEMD. And how do our listeners and viewers find you?
So there's a few different ways. So you can go to my website, which is drshelbyharris.com, DR for doctor. You can also find me on Instagram. I do a lot of stuff on there at sleep.shelby. And then I have my book, The Women's Guide to Overcoming Insomnia, and then The Essential Guide to Children's Sleep that just came out in June this year. So you can find me any of those places.
Thanks so much for joining us today on SHEMD.
If you want to own your own health, a good place to start is by following us on social media at SHEMD Podcast, and by subscribing to our show on YouTube or wherever you get your podcasts.
For takeaways from today's episode, visit our website, shemdpodcast.com. We'll see you next time on SHEMD. This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SHEMD, some of the products and services we discuss may involve sponsorships or paid advertising.